Welcome to the Live the Health You Want podcast, where we discuss issues of current topics for health, wellness, and longevity. I'm Stephanie Shorr. I'm a health and fitness trainer. I'm also a nutrition coach. I owned a gym for 12 years and watched many transformations as people got into their best health. So join me today. I'm with Dr. Monica Gill. She's a plastic surgeon. She's double board certified. Her history is amazing. We'll get into that in a moment. And what really stood out about Dr. Monica Gill when I met her was how interested she was, how really concerned she was for the entire health of her patient, not just the part that she was helping them with skin or something else. And she wanted to know how they ate, how their digestion, every aspect of their health. And I think that's really the best way to be with the doctor is to be collaborative and be proactive about what your needs are and any issues you're having that maybe don't even seem related because they could be. So with great joy, I'm introducing Dr. Monica Gill. She has a center in West Palm Beach called Pulsar Health. I highly recommend it. You go there, meet her, look at her website. It's phenomenal, the kind of things that she can do to rejuvenate your health or to repair something. Check it out, pulsarhealth.com. So what I thought we'd talk about is, I'm very impressed with your facility because it's like not just the end plastic surgery that you come when you're ready to do anything, but it's also, you look at your patient, and this is what I noticed about you right away, your clients. You were interested in the whole person, not just what they're coming to you for. You want to know about them and their health and their eating habits and their everything to make sure they're in their best pot. Because I totally agree. If you're going in for surgery, you want to be your best self going in so you get better results and you heal faster. You don't want to be like someone who doesn't exercise or eat well and then expect plastic surgery or any kind of other treatment to be magically forever. So I like how you take that in, and also you do a lot of other treatments that are not so invasive, it seems like. And I thought maybe we could talk about that because I think people could be educated more about that.
Like our physical body is a manifestation of our habits and our thoughts and what we do with ourselves, as well as our genetics, obviously. In a similar way, when you come to a doctor to improve your appearance, it's not just the appearance. There's a whole many layers underneath that, and we need to see, is it the right fit for you on multiple levels, not just like, oh, you want something, let me do it for you. It's not, I don't have like, this is your order, let me give you what you want in terms of your menu item. I have to assess whether it is actually in your best interest or not. For example, if I was a restaurant and they ordered a double cheeseburger, and then would I just give them a double cheeseburger? Yes, I would. But as a physician, as a healer, I have to think twice. Is a double cheeseburger what they really need right now? It might be, but it might not be. But so there's an element of like, okay, is this the right thing to do for this person going on, as well as the wanting to provide a service for them.
So really, when you interview your clients, you're looking at their whole picture, because there may be
the original role of a physician is to do no harm, and it's also to help, so and it's sometimes people think that something will benefit them, but there's always pros and cons to whatever intervention, and as the person, they are trusting with their body, with their life at times, then there is a responsibility to guide them in those. It's obviously their independent decision. They can go where they want, do what they want, but I take it as my responsibility to look out for their best interests.
It's kind of like a fiduciary duty.
Yeah, except
because you're representing their best interest.
Yes, but
Yeah,
it's an expectation in medicine that may or may not be true anymore, but it's the way that I was raised in medicine in England. In England, the surgeons take care of the medical problems as well as the surgical problems. Here, everything is kind of outsourced. You might have some chest pain, let's get a cardiologist. Whereas there, it's like you have chest pain, what could it be? Different things, and you work it up, and then if it's cardiac, you call the cardiologist. So
right,
it's a
right,
difference. It's more of we are in charge of you as a whole, rather than we kind of or we're it's a little bit more taking responsibility for the whole, but we are also trained to understand that it's not that we're trying to take responsibility for things we don't have any training on. The basics we
right.
are trained on, and so we have some idea of, because there's so many ways something can present. You know what I mean? It's a chest pain, maybe indigestion, it may be a panic attack, it may be cardiac, it may be lung. And
Right.
so just calling for specialists it might delay your correct treatment by hours, which could cause you a huge amount of harm. So it's up to the initial provider to have some system of, figuring out, okay, which is it most likely to be, how urgent is it, and how can we best deal with it. So there is an element of working together as a team, including with the patient or the client.
Collaboration,
Yes,
collaboration.
it is, but there's also a responsibility
Right.
to do the right thing by them. So it's a combination of both. Does that make sense?
Absolutely. And it's actually, I feel like the way medical care is going now is the doctors are being more collaborative with their patients because I mean, as lay people, one thing happens to us, we research it. We think we know everything by the time we go into the doctor. And it must be really annoying to someone who spent decades of their life
It's
in
not
training.
annoying because I'm always seeking to learn and grow myself.
Well,
So it's
good.
not
Okay.
annoying. And yeah, and
Not
it's
everyone has that attitude. And that's what really struck me about you is how open you are to the collaborative nature of a client and a medical professional. And I was really fascinated that you offer such a wide spectrum of services. How did you describe your facility? Do you describe it as a medical spa? Because it seemed to have elements of spa and beauty treatment and also medical and even surgery. It seemed to encompass everything.
yeah,
So,
it's a holistic center for health and beauty.
and it's called Pulsar Health in
Mhm.
West Palm Beach. I highly recommend you look at the website. It's pulsarhealth.com?
Yeah, and we are changing the website. So look at it in about a month or two.
I thought
So,
it was very informative. It was very informative about you. I thought your credentials are like amazing. You're a surgeon at the Royal College of Surgeons in London, and you got your medical training there, and then you got a degree from Hopkins in biotechnical something.
yeah,
And you did
biotech.
research at NIH. I mean, you've been all over and you worked with plastic surgeons like Robert Maxwell. I mean, you really, you're my go-to for a lot of things right now.
Thank you.
Because I think you can enhance, as you described also on your website, you can enhance and rejuvenate. And I like how you're concerned with what's causing all this dry skin or what's causing this rash or that kind of thing. You're very interested in that. So it seems like if anyone, you could identify, even though you're a specialist, you can identify symptoms for many different systems in the body. Or you can help the client maybe go to a specialist if they need that, if they need gastroenterology or urology. I mean, it's funny, I coach people in nutrition and I find that most of them, just something as simple as not drinking enough water can heal what's wrong with it. It can just quell some inflammation or change things. And I just think to have someone you're collaborating with, like if I was to go into for a procedure and you would say, well, what about this part of your life and that? It would be so much more valuable to me and it would build such a trust between us in the collaboration. I think that's the future of medicine, honestly, that it has to be more personal. Everyone's different.
Yeah, right, we're all as you said, everyone's different, and everyone has different facets to their life, and they may come for one facet which is important, but to see them as a whole is a way of providing a richer experience than they expect to get. It's about seeing them as a person with their own life going on, and seeing what the different ways we can support them in that and celebrate them in that. Because many times people aren't celebrated, they aren't treated with the kind of welcoming warmth that I value in relationships. And so we may just have met them, but we care about them. And it's an element of relationships that I value in my friendships. I value people who care about me in terms of what's going on with me, what makes what the main issues are for me. And in a physician client relationship, it's a strange relationship, because you immediately get to the important stuff pretty fast, because they come in with something that matters to them. Now, some people might come in for a facial, and they don't care about dealing with those things because it's not relevant. But other people, especially in plastic surgery, do. And in the wellness, the weight loss program we have, the weight management program we have, there can be many issues at play, and they are trusting you with their stuff, and you have to well, I feel that it's important to respect that trust that they bring to the table, and to try to figure out at what points could we be the most helpful, because sometimes it is with what they bring in, and sometimes it's with something else. And also, is it safe to do what they want to do? And so it's a case of balancing that out. The values for Pulsar Health are fun, ease, excellent results, safety, and together. So those are the 5 things that we seek to bring in all our relationships.
Beautiful. How do you start with a client that you can see may have a weight issue, but maybe they don't think so? Do you give them their BMI and discuss it? And could you maybe describe your weight control program a little bit? Because I'm really interested in that.
Nobody comes in unaware of their weight issue. So it's not something I have to point out to anybody. It's not me saying they come in with their problem, and I address if I can help them with their problem. So I may not be able to, and sometimes it depends on where they're at in their life, whether they're able to or not. Just because you have something you want to deal with, this might not be the right time to deal with it. It might not be the right circumstance too. You might not have the right finances at this point. You might not have the right support structure. You might not be in the right place with your job or psychologically. So there's a lot of timing things that go into whether something is the right thing to do for you at this time. So for the weight management program, you have to, the way we do it is not simply prescribing a medication. We work on habits and lifestyle, and if you're not in the right place to work on that, this might not be the right fit for you at this time. So it has to be a fit. It's not just like you're coming in for a service. It has to be the right fit.
Okay, that's really perfect.
Yeah, that's different from most providers who you come in for a weight loss med, you get your weight loss med. We want our clients to succeed. And so we're not going to take on somebody who's not ready to succeed. And so we are selective in who we pick and how we work with them. Because we have an extremely high success rate. We've only had one person not lose weight, and that person was drinking. Yes, that person was drinking over a bottle a day of spirits. And they were not willing to change any of their habits. So after a few weeks, they said they were willing to change, but it turned out they weren't. And they wanted to rely on the medication, but that's not this program. And so that was the only person out of everybody we've had who has not lost weight. So it's
always one.
Yeah, but I mean, that was learning to select better. Now I know if people have an alcohol issue where they're drinking over a bottle of spirits a day, that's not going to work.
That's quite a lot. That's all sugar in the body. Turns to sugar, it ruins your liver.
It also helps. It also interferes with your ability to make good choices for yourself. And it's it's something I realized that I tried to see if we could help, and I realized we can't at that level. At that level, it's this isn't the right program for you, and it wasn't the right time.
What do you have any hints or help for people who are addicted to sugar, which is really most of the country?
They I most things have a multifactorial origin, or it's more than one problem going on. Health is a collection of different things. It's our bodies are always trying to heal, and there are always a lot of factors that are helping us heal and factors that are interfering with us heal. And so it's rarely a one thing will tip you into illness. Sometimes it does, but many times it's the overall collection. For example, the people who were hurt most by corona were those who were already had impaired immune systems, or were weak, or very elderly without having a robust health. So it's not one thing, it's one thing among where you're at.
Lifestyle choices, a lot of it.
It is, but it's also how convenient are different choices. What are the other pressures going on? Because many people have a pressured lifestyle where they have a lot of commitments, and they don't feel they have the space to cook and eat well. They often reach out for convenience foods, and many of those convenience foods are loaded with sugar, or are highly processed foods that are going to turn into glucose in your body pretty quickly. So it's not some people are majorly disciplined and can just stop sugar, but most people require a combination of things in order to break addictions. It's creating, so when we have our wellness program, we work more on support and nurturance first before we say stop this or stop that. So it's a case of building the support structures around the person, building the habits that nurture them, so that they have the energy, the space, the resources to stop what is harming them. So we do want to break addictions, but they also, and so with that lady who had the alcohol addiction, she wasn't working with us to build the support structures. She just wanted the medication to fix it.
Wow.
And so but we needed her to work more on those other things, and she wasn't willing to do that. And so there are also psychological reasons for why people are where they're at, whether it's a spiritual reason or a psychological reason. There is an identity issue going on as well, that this is who they are. And so in order to shift the identity to a slender person, there may be layers of protection that they have, and unless they're ready to let go of those layers, it can be very difficult for them to change. We talk about change as inevitable, and it is, but is it the change that we want? And how much control do we have of the choices we have? We do have control in what goes in our mouth, but if you're hungry and whatever is convenient is right there, you're much more likely to eat it than if it's not. So I don't have my approach is not one of dictatorial. My approach is one of how can we make it easier for you to make the right choices for you.
That's excellent. And that's really, like I said, again, I think that's the future of relationships with doctors and clients, because like you said before, this one woman just wanted the medication. Well, we were brought up like that you go to the doctor, something's wrong, you get a medication. And so it's a lot to unlearn and a lot to unpack for a lot of people, that to have a doctor who really cares about you as a whole person, and you'll have better results from any treatment they do if you're at your best. You're your best self. You present yourself for the procedure or something like that you're not.
Yeah, I think that we don't tend to, we know our health is important, but we don't realize what an impact it has until we're sick, or we have an accident, or we have a problem. We just think it's always going to be good, but then we get hit and we're like, oh, I should have taken better care of myself, And at that point, you've already, there's so many things have already led to that, that many times, if we do things in a way that's if we maintain our reserves, we don't take such a hit when life happens. And so it's, I mean, life is going to be messy. It just is what it is, and you got to have fun with it, and we just make the best of it. So it's
Well, the other thing is our DNA, and I'm really interested in this. I'm studying this a lot. Like our DNA is more like cave people than modern creatures who can absorb all these chemicals that we're ingesting on a daily basis. And our bodies don't really know what to do with it. And I think it's having effects like making us sick. I think it's stiffening our cell membranes in certain ways because I think the permeability of this, I mean, I'm an artist, so I think about things like on this, I think about nutrients coming in and waste going out. If your cell membrane isn't permeable, then you're going to have problems. And I think that's kind of what happens with too much insulin. The cell can't take any more in, and you have to get the sugar out of your blood. And I mean, I just think there's so much we can do for our health. And I think people really, we haven't been educated, Monica. I don't think we know how to take care of our bodies in a lot of ways. It's not anyone's fault. Our doctors were trained to treat our symptoms, not to figure out the cause. I mean, of my age, I'm baby boomer. Now it's more like you. Doctors are more like you. You want to know about the whole patient. That gives me hope.
well,
It does.
it's I don't know how how common that is in terms of medical care. I think some of the complementary doctors and some of the PCPs have these kind of principles. I think many doctors want to provide this care, but the systems of big medicine that they work in make it difficult to have the time to do that, because you are expected to see a certain number of patients in a certain time frame, which doesn't really have much flexibility in terms of getting to root causes. So I think
Right,
that,
right.
I don't know how commonly in medicine this practice is happening, or whether the future will have this more commonly. I also and also want to say that it's not just doctors now, and more practitioners and nurse practitioners or physicians assistants. I never even saw my PCP when I was in California. I couldn't get an appointment for months. And so
Wow.
it's not that you have a doctor, you're going to see a doctor. It's all healthcare providers, and how are they going to approach your health. As far as the cells membranes, as you're saying, I think you're correct in the term, in thinking that our bodies may not know how best to process some of these artificial chemicals that are coming, that are being absorbed through our gut, because they are somewhat similar to natural things, and they can get in. If they were completely alien, they might not even be able to get into our bloodstream. And so the our body is used to dealing with toxins. Alcohol can be a toxin too. There's a lot of microorganisms where we live in an environment where we're exposed to toxins. So we have the ability to cope with toxins and to regenerate our cells to some extent. And I talked about the forces of things that are homeostatic and helping and being harmful. It's a case of how many toxins are coming in versus how quickly we clear them out, and how much we can regenerate. So just because we get exposed to toxins doesn't mean we're going to get sick, or whether it's going to kill us. It depends on what are our supportive forces of healing that. And that's why we work on supporting your health first, like getting adequate sleep, getting adequate hydration, eating enough of the nutrients in more natural type foods. Those things can help with and also with de-stressing emotionally, being healthy. All of those things are supporting the things that fight the toxins.
Right.
I don't think that one drug will ever, change the course of humanity in terms of being a cure-all. If there was something like penicillin would be it, because it did save many lives and still continues to do so, because antibiotics do make a huge difference. So drugs have their role in helping us,
I agree.
but they aren't the sum total of everything, and neither are the toxins. We are complex beings, and so it is that balance of what's going in and what's coming out, and how we're handling it that matters.
So what makes sense is for us to do what we can without going crazy, because it's easy to
Exactly.
do that, to do the
Exactly.
best we can, to eat a healthy diet, to get enough exercise, to have some relaxation time, to get enough sleep, to just do everything possible on our end to,
Yeah, and
to
those are some
to
of the
take care of our
yeah,
body.
And those are some of the physical components. But as I said, many times there's emotional and psychological components too. And the placebo effect is where 30% of diseases are cured by the mind itself, just with just a simple
Wow.
sugar pill. And so you don't want to underestimate the effect of your own mindset, your own psyche, because it
Very good
can
point. Very good.
it, and that's on an unconscious level. Suppose you apply those abilities in a conscious manner, and so it's not just the physical is like the end result, the outcome of all the things that are going on, that make up the whole sum of who we are.
Very well said. And it's very complicated and complex. I mean,
It
on
is.
many
We
levels.
don't. Yeah, it is. But we don't need to know everything. We just need
Right.
to know a few of the levers that we can adjust easily, like stopping sugar. That's good. That's generally going to be a good thing for most people. And so we know that that's a useful lever, and we can work on that lever. We know exercise is usually a good thing for most people. For some people, they need more gentle exercise. Other people need more intense exercise. So there's subtleties in it. But overall, what levers to work on. It's just a case of, do you have the support structure to work on those? And how, if you don't, how are you going to do it? Are you going to find a good trainer? Are you going to find a way to eat better? Are you going to, how are you going to apply? Because it's a case of prioritizing and then working on what to work on.
Exactly. And usually I find that when I have an appointment with my DO, I've been going to for 20 years, there's a lot of things I've been thinking about, but the most important issues float up right away. They just, it's like your body's kind of speaking through it. I'll tell you one thing that's really fascinating me lately is all this research coming out on the microbiome. It's probably already been there. I'm usually late to the party, but I'm so fascinated by that. And
I disagree with that. You're not late to the party. You're a trendsetter.
Well, thank you. That means a lot. But at any rate, Dr. Stephen Gundry, who I will tell you, when I first heard of him, I thought he was totally wrong because I was on my no fat, no oil, no animal product diet. And he said, the only reason we eat is to get as much olive oil as possible into our bodies. I'm like, that's crazy. I don't think I didn't pay attention for a year. And then I read the Plant Paradox, and the microbiome, I don't think we eat foods to support it.
Correct. Yeah.
And I think if
Our
we did,
diets don't.
we'd have better health and less leaky gut. So I was so
Yeah.
inspired. I'm sorry, I was so inspired by his descriptions. I did sketches and hired an animator. And I'm trying to illustrate that. So I'm really having fun with that. But it's
I think
fascinating.
that
How
would be
for
really
you?
helpful. Yeah, that would be really helpful to educate people on it. Even one of the oldest medical sciences is Ayurveda, which is from India, and it's thousands of years old. And the gut is the root of health. In that they work on the gut, and we are in symbiosis with bacteria, and they help us digest things, they make vitamin B12, for example. So there's different functions. They help reabsorb our bile salts. So there's different functions of we're not by ourselves. We live in the context of our environment, whether it's our internal environment with our gut or our external environment with what's going on with viruses and things around us, or even in taking a walk by the ocean. If you're not bitten by mosquitoes or no-see-ums, you do have the salt spray, and there's something about that is nurturing. So it's a case of finding what you. I keep coming back to this theme of nurturance versus toxicity, and getting that balance for ourselves, in relation to multiple interactions with things like bacteria, and interactions with things like our environment, and interacting with the Starbucks, interacting with our friends and celebrations, and the choices we make with each of those. I don't know if that's helpful. I don't think it's helpful. I think it's confusing, but
No, I
I'm
think it's fine. It's more of the whole picture is important. You can't say it's just a digestive issue. It might be related to the stress you're feeling, and the stress is related to your relationship issues and it goes on. We're pretty complicated. Considering the more I read, the more I'm not really sure who's in charge here when there's so many more cells in our gut than there is in our body. And
but the benefit is, though, that because there are multiple layers, you can work on one or two layers at a time and improve those. You don't have to
True.
do everything all the time. You can work on just one or two things, get them solid, and then work on another thing. So you don't
Right.
need to know everything. You just trust your knowing. Like you said, when you go to your DO, the most important things come up. And so we do have an inner knowing of, okay, what's important for me right now. And so just trust yourself in terms of knowing what to work on right now. You're not going to work on everything. Just pick one or two things that you think are right for you to work on and just go with that.
Exactly. Because that's all you can do. Otherwise, you wouldn't get any work done besides that. There's just there's just so much real estate in our bodies and so many things that could be looked at. And I find it really fascinating the effect of food, how much effect everything you eat has on the body, and how I'm reading about lectins and things like that, and how some people react to lectins that are a result of low-grade inflammation over a long time. Like flour might give them a leaky gut. It doesn't happen right away.
Mhm.
And I'm thinking, I never knew
And-
stuff.
yeah.
Yeah,
And you might be sensitive to some stuff for a while, but then as you build up your immune health and your overall gut health, you may no longer be sensitive. And so
right.
it's
Right.
a fragment in time that we're looking at. And in terms of what to eat, there's different types of approaches in figuring out what to eat. Like we talked a little bit about in the past, not on this call, but we talked about the blood type diet, which looks at your enzymes and what your body is designed to metabolize more easily. And then there's other approaches like in Ayurveda, there's Kapha, Pitta, and Vata, which is also another way of categorizing your body into things that are better for you or not so good for you. So there's a lot of information out there, and it can get very confusing as, okay, what's actually correct for me? And sometimes it's an amalgamation of different things, and sometimes it's trial and error. Like, does this make me feel better? Does this not make me feel better? But you have to give the trial a good, like at least 1 to 3 weeks to see, okay, does this actually work for me? Rather than making premature, because it takes a couple of weeks for things to flush out of your system many times. So you need to give it at least 3 or 4 weeks of trying something to get an idea of, is this good for you, good for me or not?
I really agree with that. And it's kind of like everyone has their own personal health quest, their health journey through life. And at my point in life, and I've looking back on it, I feel like I could have done more, but you do the best you can in the situation you're in without getting crazy about it. And there's so much material available now to learn on the internet. It's just, for me, it's like a playground
It is,
because
but not all of it's accurate. So
exactly, that's true. But you know what? I respect that, but I have to tell you, I was listening to a seminar yesterday with two live people just like us, and they're saying all these things that I really don't think were true. So it's like it's kind of like AI. You take from it and you verify.
Mhm.
But for your own health quest, you need to do that for if you have to
Oh
research
yeah,
something.
a lot of it is about context. As you know, I worked at NIH for years, and I've also done other research at Pittsburgh, and so I've spent like years doing basic science research. And a lot of the times, you look at the data, and you have to see what context it's in, because it's like stats, you can find different things. You have to see, is the
Right.
population they're studying similar to your population? Is the way that they studied it unbiased? Do they have controls? You look at the data in terms of not one piece of information, but are different pieces of information correlating with the same finding. For example, when you have an experiment that you do in a basic science lab, it needs to be replicated 3 times for you to say, oh, okay, this is real. Because 1 or 2 times can be random. And so their data, it needs the structure of data has to be reproducible and verifiable. And I think that's where a lot of times the more individual care of medicine is difficult to study scientifically, because a human being has so many variables that it's difficult to compare apples to apples. And so the
True.
traditional Western scientific approach might not be the way that we can study more a more individualized practices of medicine, such as such as Ayurveda or acupuncture, because those practices are much more designed to heal the individual as well as treat the symptom, whereas Western medicine is more geared on treating the one or two problems as opposed to treating the individual. So it's much easier to analyze Western data than it is to analyze Eastern data.
Oh, that's true. Yes.
Yes. So I think that the if you want to compare apples to apples, you need to look at things that are in common with both, such as quality of life metrics, such as longevity, those kind of metrics that are more comparable rather than individual treatments. Because like for example, the blue zones of the world have people who
Right.
live a long time and have good health into those later years. They're not just alive, but they have quality of life during those later years. And so then they pull information from those, as in what are the things that are working there. But then if you apply those to other areas, you should be able to see an effect if those things were correct. Now, have we done that? I don't know that we have. I don't know that we have applied those factors into a defined population and seen that they live longer. That kind of data studies take a long time, and you have to really control the variables. And so it's difficult to go by data alone, because data is a piece of the puzzle. And if it's a very useful piece, as many things that Western medicine does, I would not be without it. It helps with hormone problems, it helps with infective disease, immune systems. There's so many things Western is brilliant at. Steroids have their place, but then there's things that the Easterns have their place at too. So
Absolutely.
as a
Absolutely.
whole world, we want both. We want all of it, but each has its place. One thing isn't applicable to everything, and one finding isn't applicable to all the population. That's why these diets that say one diet works for everybody doesn't, because people are built different. It's not going to happen that way.
I'll tell you what really interests me that I've kind of been looking at a lot lately that I never understood before was, well, the things I like to research. I respect what you're saying about all the data. I'm not quite as scientific as you, so I'm looking at more explanations how things work. Like, how does the liver work? How does this impact that? And I'll try to do things to support my liver if I feel like I've been eating poorly or something like that. But those are kind of like the videos I like to really study. They make a lot more sense to me, and it's very visual what happens in the body. What do you think? What do you think the effect of sugar is in the fructose? Do you believe what I've read, and tell me if you agree, is that fructose has to go to the liver to be processed, and it turns it into fat? A lot of times
So
it
fructose
seems
is
to
a mixture of
raise the
two
triglycerides kind of thing. That was so disturbing to me. I dropped my fruit consumption and my triglycerides went down. I was shocked.
Yeah, if you have excess of sugar, whatever sugar type it is, whether it's glucose or fructose, whatever type of sugar it is, then the excess sugar gets converted to fat. And so it's not that every sugar you have is going to be turned into fat. For example, orangutans, their diet is a lot of fruit, and they're not
True.
all obese, or unhealthy. And if you're going to have fruit versus you're going to have, pecan pie, the fruit is better for you. And so I don't think that it's like, oh, fructose is bad. A high fructose corn syrup, I agree, is bad.
Yeah,
There's no way you
definitely.
can sugarcoat that one, as it were.
Yeah.
But I don't think that fruit in itself is bad. It's like, how much do you have? How often do you have it? And a reasonable amount is good. Like, for example, dates are very sweet, but they don't raise your blood glucose. And so it's how your body metabolizes it that's important as well. So I think that's where I'm saying applying one finding to everything is dangerous. And
I agree. You're totally
and
right.
yeah, so
Totally right.
it's
And thank goodness for dates. Thank goodness for dates, because they have fiber. I would really love to hear a little bit more about some of the rejuvenation procedures you do at Pulsar Health. If you'd like to describe it, like, I think there's one called microneedling. I'm not sure what that is. And
so
if you don't mind, I'd love to know that.
Okay, sure. So when people come in, they like we talked about earlier, they have a concern. And so I try to figure out what concern they have. And it might be a concern with their facial skin, it might be a concern with their hand skin or obstructing the veins, it might be a concern with too much skin if they lost weight, or their breasts getting saggier, or having love handles or belly. It might be a concern with not having enough energy. There's different types of concerns, and rejuvenation is a very broad term. So it's a case of trying to address what's bothering them, and rejuvenation is a consequence of treating what's bothering them. In terms of skincare, microneedling, you talked about, is a skin treatment. And so there's different types of microneedling and different ways to do it. Microneedling is a bunch of little needles that go into the skin, and it's not as bad as it sounds because we do use numbing, and so you don't really feel hardly anything. There are different depths to which the needles can go in, and the point of microneedling is to cause as in many aesthetic treatments, it's to cause a micro trauma. When you have a trauma, you have healings come in, and the balance is, are you causing too much trauma, in which case the healing might be sort of scar type healing, or are you causing enough trauma but not too much that you have healthy collagen and elastin forming in response to it? And our goal with microneedling and other types of cosmetic lasers and treatments is to have the enough trauma, not too much trauma, that we get healing and growth factors and new blood vessels and thickening of tissues, which results in a rejuvenation appearance. It can also be used not just for anti-aging, but also for treatment. For example, if you have scars from acne, or you have pigment issues, you can break those up. And we also combine our microneedling with things like stem cells and growth factors and brightening agents. So we don't just microneedle with one thing. I always work on giving people the best result for an intervention. So where I can layer treatments, I do. Like I layer the microneedling with the growth factors and stem cells, or I layer it with something like radio frequency, and I can layer it with the growth factors. The radio frequency tightens the skin. When somebody's getting a little older and their skin's losing elasticity, adding the radio frequency element can give them an extra reversal of aging, because it just tightens and lifts things. And so there's different ways of addressing every problem. When somebody comes in, I try to figure out what bothers them, and then what would be the most effective solution for it. And I offer 2 or 3 because it depends on their budget and their time frame and their preference for downtime. So there's different considerations in what would be the best treatment for them.
That's perfect. How long does the microneedling effect last for tightening the skin?
Well, the effects are all if you go to the right depth, all the effects are permanent, because you're creating collagen, you're improving the skin blood flow, but you're also aging. So again, it's that balance,
right. The balance,
nurturing it versus the toxins that are continuing to happen. So whatever we do does have an effect. Things like doing facials and more aesthetic treatments, they are helpful in like declogging pores and in stimulating the skin too. And the amount of effect can depend on how deep the effect is. Even some acupuncture can be cosmetic, and we don't offer that at this time, but that works by improving blood flow. And so it can there's different pros and cons to all the different treatments, and it's like your teeth. You don't just brush your teeth and then hope they stay forever. You have to work at it a little bit. So it's you're taking care of your skin, which is the largest of the organs of the body in terms of area. Your gut is also very long too, though. So the inner and the outer skins, both of them are super important. But things like wearing sunblock, which people think you only need for the sun, but blue light also affects your skin, and sunblocks can block blue light. And so all the screen time and the UV lights you're exposed to all the time, you're getting that harmful effect, which if you just slapped on some sunblock in the morning, you'd be good. So there's a lot of preventative don't do that. It's a no-brainer, but they just have an idea that sunblock is for sun. That's not the way it is.
I never heard that before. I have a blue light screen on my laptop and phone and iPad, and then I have blue light protectors in my glasses, but I
But
like
your overhead lights
also
can still be emitting blue light. And
polyphenols,
yeah,
having a lot of polyphenols in your diet, like olive oil and berries and stuff. That's the plant's defense against the sun. So
yeah,
you get a little bit of that too. So that's kind
good.
of like an inside out one.
Mhm.
That's really, it really resounded me when you were talking about how when you're doing the microneedling treatment, the cells react by producing growth hormone and stem cells. Is that what's
No,
happening?
no, it's not the reaction. I add that in.
Oh, you
So
add that in.
yeah,
Oh,
yeah. So when
oh,
you're microneedling, you absorb
awesome.
80% of what's put on the skin versus 7 to 8% when your skin is intact. So that is the time for me to really push in the growth factors and stem cells. So I've added that as part of the treatments we offer at Pulsar Health. Most people don't offer that, but I've added it in because I think it's super helpful. You can also do PRP, which is platelet-rich plasma. You can put that in, and that's actually known as the vampire facial, where you have a microneedling and then you put on the platelet-rich plasma. And
Into the microneedling?
yes, so after, yeah, and
Wow.
so that's your own growth factors. And so people do that instead. The growth factors you use, you have to be selective as to are they effective too. Some people's plasma is not as rich as other people's, like if they're not as healthy, if they're dehydrated. So those things are irrelevant too.
Well, you're inspiring me. What time do you open?
We're 10 to 6 Monday to Friday.
That's inspiring. Because when you were saying it, I was thinking, well, like when you fast, your body starts to produce more stem cells and growth hormone. Like the adversity it perceives makes it work better. And that one thing I've really noticed in life is that I thought, I never has this much food been available at any kind you want, any time of day. You can have any kind of cuisine. I think we've gotten so complacent, and that's not helped our bodies at all. Look at the health in this country. So it seems to me, and it surprised me because I thought, well, complacency, everyone's happy, be healthier. No, your body thrives on a little bit of adversity. I thought that was so interesting.
It's a balance. For example,
Yeah.
I was in Pittsburgh for general surgery, and Pittsburgh is one of the top 5 general surgery programs in the country. And we had a trainer for the surgical residents, and he used to be in sports because surgery is akin to a sport. The hours we work were enormous, and people's lives are in your hands, And so we had a trainer, and he talked to me about optimal peak performance and function. And Pulsar Health is all about peak performance.
Perfect.
And so that's where we talk about excellent results. We want peak performance. And for peak performance, for an athlete, the best way to have it is to have half the games that you win and half the games you lose, because winning that half of the games keeps you having some confidence and that feeling of, yay, I'm good, I got this. And then losing half makes you improve your skills. It makes you push harder, makes you grow more. And the same is true of our health. We want to have comfort, but then we also want to push ourselves. Same with exercise. We want to relax and let our muscles recover and heal, but then we also want to push them. And it's that balance of stimulation and recovery, that ebb and flow in life that contributes to a different level of peak of living in a state of peak performance. Peak performance is never a one-time thing. It's like, what level are you performing at? So we try to help people perform at a higher level, live and enjoy their life at a higher level.
Exactly. And I think to me, having been a gym owner and having seen people transform with regular exercise and modification to their diet really pretty quickly, couple of months. It's really amazing how quickly your body
It's
responds
true,
to
but also people also hit a wall where they feel like they're not making any progress. And one of the client who actually inspired our wellness program, she had been going to the gym regularly 3 to 5 days a week and had that stubborn 20 pounds that she just couldn't get off. And so we worked with her, and she lost 27 pounds.
Wow.
And she kept it off for months now, and she's super happy. And the gym just wasn't enough. You know what I mean? She needed something more in order to get her to where but she kept going to the gym. So she's maintained her weight because the gym has its role in long-term maintenance. It might not get you there, but it is essential for keeping you there. And so, and for some people, it might be all they need. It might be that last little piece of the puzzle that's going to get them where they want to be.
I just feel like somehow, if people can incorporate strength training for their bone density as they age, that would be really valuable. Things like that.
Training, yeah, it's super important. It's we're not designed, as you said, to sit around. And the strength training is important for not just your muscles but also for your bones and for the tendons and ligaments in between. And hip fractures are a leading cause of death. And it's a combination of all the things that got to that point. But strength training is part of recovery from hip fractures, and also a flexibility training. They go very much hand in hand, because you want to build, but you also want to have it be functional and fluid, and so you have to stretch it too. So it's very important to prevent injuries by combining flexibility training with strength training.
Absolutely. And stretching too. That's by it's time for me to stretch, I'm exhausted. And I don't do enough of that. And that you find out when you haven't done it too. I do yoga. I think yoga is wonderful, and meditation. I think those are important components of health too, because it helps keep stress.
Yeah, one of the great things about yoga is that you do combine strength with flexibility. So it's good that, because it does both. But yoga, I did yoga teacher training twice. I never completed my hours because I ran out of time in terms of doing medical work. But what I love about yoga is that it was originally designed for one-on-one training, not as a class. And one-on-one, your body is going to benefit from different things at different times. You might be better off working on your core one day. You might be better working at spinal mobility or your hip opening another day. And so it's a class is good because at least you get out there and you do something, But if you want to really hone in, like I guess an Olympic athlete has a coach, you work on certain areas that are your limiting areas. So an ideal practice would probably a combination of private yoga classes and the general yoga class, because it's nice to have a mix of both if you can, so that you work on your individuals, but you also have the camaraderie and the overall practice of the other areas that you're not currently focusing in on.
And it keeps you connected to it. It keeps you more interested, I think, in continuing to do it.
For sure. Yeah.
It's more fun. Classes, or I try on my best days, and I'm not saying it happens every day. Like if I have early meetings or something, maybe not, but I try to do sun salutations every morning.
Yeah, you're great at that. Yeah.
I move around a little bit first, because you don't want to just go right into stretching right away. You need to warm up a little bit.
Yeah.
So I'm moving around a little bit, and then that, and then the morning light. Do you agree that morning light's important for your circadian rhythms and things like that?
Yeah, for sure. It affects your pineal gland, and that affects your hormones. And so your eyes are directly connected to your pineal gland. And so it's definitely not directly connected. They go through the optic nerves to your occipital lobe and then to your pineal gland. But in essence, it's very important.
It's right there. You're right. You're right. And that's what I take melatonin for.
Yeah, there's pros and cons
all the time.
The melatonin, the commercial melatonin is about 10 times the concentration of what's in your body. And so there's pros and cons to it. So I try to get people to have a non-pharmacological bedtime routine that they work on in order to not be reliant on the pills. As a doctor, you're like, why aren't you doing the pills? Because I don't think pills are always the answer. Sometimes they are absolutely the answer. Like high blood pressure, if you let it go uncontrolled, it could kill you. It could give you a stroke. You have to take the pills until you put in all the practices, you get your blood pressure down to normal, then you can start trying to wean the pills. There are times when you have to have the pills, but there are also other times when you don't, when it's better to not rely on the pills. It's better to see how you can fix the habits. And that's what wellness program is about. Both. It's about medication and habits, and working so you don't need to be on the medication. Your habits get to a place of strength where they support you, and then you can cruise more easily and enjoy yourself more.
So you're viewing a supplement as a medication in that in that way, because it really is. What's the difference? Nothing. It's a
Yes,
chemical.
exactly. Yeah.
Oh, I think I take no chemicals. I take vitamins, but it's the
Yeah,
same
yeah,
thing. And
it
then
does.
when you combine them, who
Mhm.
knows? It's a whole
Yeah.
nother thing. But I think they have a lot of benefit.
I think the supplements have a lot of benefit when directed for an individual to treat a
Exactly.
certain thing for a
Everyone's different.
certain period of time. I think supplements are not for everybody all the time. And and if you have the right diet, then you shouldn't need supplements. If you do have supplements, they may be for a specific issue that you have. And in that respect, sometimes naturopathic doctors can be very helpful in identifying, okay, this is an area where you need supplementation. But supplementation is like medication. It's not necessarily forever. It's for a period of time until that thing is fixed or healed.
I
I think
totally
that,
agree.
yeah, a lot of
Agreed.
times people
And
kind of lose.
the way I select my supplements, I do blood work and I have a meeting with my DO, and he helps me design my protocol. And I
Yeah.
really, and that's being said, I'm going to say right now, everything said here today is not recommendation for anyone in particular watching it. Feel free to call Dr. Monica Gill on your own. She can help you, but we're just discussing anecdotal and research kind of topics for everyone's, knowledge and interest.
Mhm.
Just want to say that our disclaimer. Okay.
Normally this was at the beginning, but I didn't know when we started.
Well,
We were going to
actually,
talk about talking, and we ended up talking. So
we're good because while I was waiting for you, I recorded an introduction for you,
okay, thanks.
which I'll send to you, and you can critique it and say no, yes, whatever.
Thank you.
Yeah, we got into it. We got into it. That was good.
Well,
I think we've been long enough. Yeah,
yeah,
we've been over an
yeah, I
hour.
think, yeah, yeah. So thank
All
you.
right.
It's always good talking with you. I appreciate your really trying to educate everybody and get the word out there and being a stand for people's health. So thank you for
Thank you
doing.
so much, Monica. And what I appreciate is from the moment I met you and you started talking about how you worked with your clients, I thought this is exactly how doctors should be. I'm already comfortable. And, she's interested in more in just that surgery I need, or like you said, like an a la carte thing. No, you said a lot of really good things today. I think people will enjoy it. I do.